Let me make a quick introduction if I could.
Yes, absolutely. Thank you.
James Alexander Joseph is about to honor us tonight with a presentation entitled Lifestyle Medicine Research Summit. Dr. Joseph is residency trained in family medicine and has been in practice for about 18 years. In our efforts to pull rabbits out of hats to make our patients better, sometimes we de-emphasize the basics of lifestyle medicine. And I'm guilty of that. And it's very important, the basics of lifestyle medicine. So I give you Dr. Joseph.
Yeah, hi. Thank you for the introduction. And the topic, obviously, it sounds like just the basic, lifestyle, diet, exercise. Yeah, we've all heard it before. But there was a reason why I'm doing these talks on this. And the reason is, and I don't have a slideshow for you, so I'm just going to freestyle it like I like to do anyways. Thoughts that come to my head, I just say it because I like to talk about what I can see as truth. I'm not reciting somebody else's truth unless it really makes sense. The article was a long article and about 28 pages. And really what it was a summit, which was, they were talking about how can they gather up all of the data from all the little studies out there that provide information about lifestyle changes that could be gathered together such that they can actually form like a big double-blind study. Because as we know, dietary changes and I would say non-pharmaceutical medications typically do not have the big double-blind studies. And that is probably why they kind of remained in the background, at least with the standard of care, meaning that they were not very specific. It's always recommended lifestyle changes, but we're not really told exactly what should we do and why. And, I understand when, somebody says, well, we need more data. It's true. Now, at the same time, some of this is just common sense. So let's just realize that. The other big thing is the fact that the NIH, the National Institute of Health, actually is investing in this kind of information or investing in ways that this information can be obtained. And that's actually a really, really big thing to me, because what that tells me is that it's come the time that this lifestyle medicine research actually needs to be done. I mean, how sick can a nation get? I can't say I've ever met anybody that says, wow, I feel good every day. I mean, let's just be honest with ourselves. I mean, to get a good night's rest, to wake up and smiling and all of that stuff. I think we're so used to, I know I'm generalizing, but we're so used to not feeling optimal that we just kind of get used to it. When the reality is, from my perspective, we should be feeling happy and energetic and all of these things, but there's just so many things happening to us to prevent this from happening that, life goes on. Well, data suggests that 60 years of review in mortality in the United States, we'll say ages 25 to 44, the most productive years, the mortality rate has actually increased dramatically. And we're not just talking about drug and alcohol use, and suicides, but hypertensive disease, diabetes, obesity, And I know it's just, again, it's like, oh yeah, we've heard it all before, but this is huge because, yeah, I mean, have you ever heard of a 20-something-year-old female with breast cancer? Have you ever taken care of a male with a history of a heart attack in their 30s? This is
Yeah.
this is not an accident. That's the biggest thing. From my perspective, it's obvious and it's common sense that this is not an accident and a part of life, and oh, that's just the way it is. That's really abnormal. And the NIH is realizing that. And in fact, it may be beneficial to the powers that be that we actually create healthier people. I'm just suggesting. What they're really doing is probably using or talking about the use of artificial intelligence in order to be able to take all of the little studies. Imagine all of the data that there exists out there, little studies, little papers all over the place, all over the world, probably thousands of studies, to be able to extract from it little things, little lifestyle habits compared to mortality rates, compared to what can be done in order to prevent this from happening, or possibly actually have a protocol as to what do you do with this person. You know, is it possible to make a diagnosis and actually have a real prescription plan for lifestyle changes? Now, this is actually a good thing for what we are doing, in my opinion, simply because we have made it clear in general that we want